Hello, my name is Kelsi Manley. I'm an internal medicine physician in Portland, Oregon. I was a grateful member of the 2022-2023 Capella Fellowship. I'll share with you today the facets of advocacy that the fellowship exposed me to and how I was able to take those concepts and turn them into action. My journey towards being a physician advocate starts in 2013, where I was a young undergraduate in Minnesota. It was during this time that legislation around marriage equality was popping up around the country. I was approached by a local advocacy group to speak with my legislator about the topic, who was hinting towards opposing marriage equality in our state. With no prior experience, I met with her, and several months later was invited back to watch her flip her vote in support of policy that would allow me and others like me to envision a future where our relationships could be recognized and valued by the state. The next 7 years were largely about just staying afloat. Getting into medical school, applying for the match, residency, and planning a career often require a lot of inward focus. Throughout residency, though, I was increasingly frustrated by the impact that bad healthcare policy was having on the patients I met. I started engaging in state-level advocacy through my local professional society and got to work with one of my co-fellows, Jill Burnett, on creating an advocacy curriculum to teach advocacy skills to residents experiencing and witnessing the same suffering I could no longer ignore. When I discovered Doctors for America and the Capella Fellowship, it felt like a natural next step towards honing my advocacy skills and finding a community of like-minded physicians who are committed to progress. Telling our stories is one of the best ways to ignite the flames of change. As physicians, we see suffering at a scale and proximity that many others simply don't. We watch as patients' health deteriorates simply because they can't afford their medications or afford the stability that housing provides. Sharing our stories creates opportunities to bring these experiences into the light. Doctors for America and the Capella Fellowship taught me key components to successful advocacy, allowing space for traditional learning of the topics, but perhaps more importantly, tangible, actionable skills to start using in my own community. One of the components of the fellowship includes engagement in a subcommittee for Doctors for America. Through the Access to Affordable Care Committee, I met other Oregonians who were working on legislation in my state related to expanding coverage for low-income Oregonians as we emerged from the pandemic. In order to amplify the voices of our patients, we must bring them to light. Community partnerships are often the most well-equipped to do this. A coalition of multidisciplinary groups work together to help address these gaps in coverage for Oregonians. Ultimately, the proposed bill was still in committee when the legislative session adjourned, but the community partnership and coalition forges on, leaning into a key concept of advocacy, persistence, in the name of better care for all. 2022 was a challenging year for healthcare access and equity. Like many of you, I was dismayed by the overturning of legislation that provided evidence-based, compassionate healthcare through abortion. Further, I watched as the rights of trans people were stripped away across the country. I shared in the pain of my friends and patients as they worried about the real impacts this harmful legislation would have on their lives. When the collective moment felt bleak, the Capella Fellowship and the principles we covered gave me a blueprint for how to move forward. Fighting back through legislative advocacy is one way to combat harmful policies and create hope in dark times. In Oregon, a collective of passionate leaders did just that through House Bill 2002. This bill would provide protections for physicians to continue to provide abortions in our state without fear of retaliation from neighboring states, expand access to abortion care, and expand coverage of key components of gender-affirming care. Through our local Oregon American College of Physicians chapter, we went to work, recruiting over 65 clinicians and students to spend a day at our state capitol in support of HB 2002. I wrote testimony in support of the bill with other physicians who were fired up. Through a monumental effort by activists, HB 2002 became the law of the land in our state. It was incredibly empowering to be a small part of a larger effort toward progress and justice in healthcare. While I was working on legislative efforts, I found myself driven to share what I was learning with my sphere of influence on social media. I have friends from all political leanings, and outreach through social media is one way that, when done correctly, can allow for personal evolution and growth. For every day of Pride, I posted a fact, resource, or reflection on the importance of gender-affirming care. I partnered with DFA to bring some of these messages to their Instagram account. Finally, as I embarked on these advocacy activities, I couldn't help but feel that physicians are an untapped resource for progress. We bear witness to human suffering, have experience with explaining complex concepts in simple terms, and have access to spaces where decisions are made that afford us great privilege. Even so, very few of us are engaged in this work, and advocacy has not traditionally been taught as a component of our professional duty. Here's a picture taken at the Pulmonary Critical Care Fellowship annual meeting, where I and a group of advocate educators spoke about the importance and practicalities of incorporating advocacy education into traditional medical education. Doctors for America taught me this year that through storytelling, community engagement, legislation, media, and education, anyone with passion and a voice can be an advocate. It's going to take all of us to achieve a more just and equitable healthcare landscape, and I'm grateful to be a part of a movement of physicians who believe that together we can create change. Thank you.